Welcome to our third session of the Q&A series that we are presenting before you for the last almost 2 months. And this is where we answer questions that you have sent to us. Because of the brevity factor, we can only answer 4 questions. So again, as before, I'm going to answer 4 questions out of the list that I've received from people who watch these videos. I am Dr. Saad Malik, and I am Professor of Psychiatry at Shalimar Medical and Dental College. So our first question today is by a 25-year-old young man who says that he has episodes of apprehension, fear. He experiences chest heaviness, there's palpitation, the heart is beating fast, the mouth is dry, and he feels as if he's going to die. He has been to various doctors, physicians, has undergone a variety of tests, and nothing seems to be wrong. All doctors tell him that this is all because of anxiety, and he finds this hard to believe because he thinks anxiety is a normal emotion, and how come it can have so many physical manifestations. So what is anxiety? Is anxiety normal? Is it abnormal, pathological? Very briefly, anxiety is a normal emotion that we all go through from time to time. Whenever you have stress or you are expecting some apprehensive event, it could be examination, interviews, we do experience the emotion of anxiety, which in fact has a safety element to it. But when 3 things happen, then this anxiety is no longer normal, and it then becomes abnormal or pathological. The 3 things are: number 1, the anxiety is excessively prolonged. Normal anxiety is usually short-lived. It's related to an event, and when the event has been handled, the anxiety goes away, which may last for perhaps a few hours or a day or 2. The second difference is that the anxiety is severe. Normal anxiety will not interfere with your everyday life, but when the anxiety is abnormal, your sleep gets disturbed, your appetite gets disturbed, your family, your work life, your performance, everything gets disturbed because of that anxiety. And the third factor is, with normal anxiety, there's almost always a cause behind it. But when you have anxiety without a cause, it means you're suffering from pathological anxiety. So when anxiety fulfills 3 criteria: number 1, it's excessively prolonged; number 2, it's severe and affects your everyday life; and number 3, when there is no cause behind it, that is when you experience pathological anxiety. So what this gentleman is going through is basically pathological or abnormal anxiety, which is a disease in medical terms. And this pathological anxiety can present in different forms. The most common ones are: number 1, panic attacks or panic disorder, where you have acute sudden onset of severe anxiety with a lot of physical symptoms and a dread that something is going to happen, or you're going to die, or you're going to have a heart attack. And this goes on for about 20 minutes to maybe an hour or 2, and then it subsides. This is called a panic attack, and when you have recurrent panic attacks, we call it panic disorder. The other form of pathological anxiety is when anxiety is of a low-grade variety and it's persistent. It continues from morning till evening. You cannot relax, you cannot unwind. There's a feeling something might happen. And this low-grade persistent anxiety is called GAD, or generalized anxiety disorder. A lot of physicians, cardiologists, see patients who think they have a cardiac problem. Similarly, gastroenterologists where patients go with abdominal symptoms or symptoms relating to their bowels are in fact suffering from anxiety and not particularly diseases of the bowel or of the heart area. So this is how anxiety can present with a lot of physical symptoms. I hope that that satisfies your query. The second question is by a gentleman who is 40 years old, and he has a problem of procrastination. Now, procrastination means that you are deliberately putting off or delaying some event or some activity which should be done, which should be done because it's important, and you delay it because you think, I don't have time. Whereas actually you do have time, but you keep on delaying it just because you're too lazy to do it, or there may be a number of other reasons why you are reluctant to do it. And so this work adds on and it just piles up, and you have loads of work waiting for you to do, and then you get scared of this enormous burden that has accumulated. So this is the problem of procrastination, and this happens with people especially who are perfectionists and obsessional. Now, if you are a procrastinator, you tend to delay things. There are three very basic techniques that you can use to overcome it. The first one is what we call pigeonholing. Pigeonholing is a technique in which you try to find out what is the real cause of delaying the problem. Is it really time when in fact that is not so? Or is there some other reason why you wish to delay it? Generally, people delay things either because they are afraid of doing it, or because they are not good at it, or they find it uninteresting, or they have some other fear that lurks around that problem. So in pigeonholing, we try to confine the real cause of the problem into its right segment. If it's anxiety, we have to deal with the anxiety of the problem. If you don't like doing it because it's uninteresting, you have to handle that. But don't blame time for it. The second method you can use to overcome procrastination is called the 5-minute rule. The 5-minute rule says that whenever you are trying to delay something, tell yourself, I'll just do it for 5 minutes, and after that I'll stop it. So if it's something important that you have to do, maybe you have to send a text message to somebody, maybe you have to clean a wardrobe, just tell yourself 5 minutes and then I'll stop it. And you'll be amazed that if you can do something for 5 minutes, in almost all cases, you will continue doing it till it's completed. It's the first inertia of 5 minutes that prevents you from undertaking that act. The third strategy is what is called chunking. You try to break the event or the problem into small, manageable chunks. So if you have to clean your wardrobe, the very thought of cleaning the whole wardrobe is overwhelming. Just tell yourself, I'll clean one shelf today and not more. So break down the problem that you're trying to avoid by breaking it into small chunks and do one chunk at a time. So there are many other strategies, but just remember pigeonholing. Number 2, you have to remember the 5-minute rule, and number 3, chunking. The next question is from somebody who has been recently married and has friends who were married a couple of years back, and they are having problems in relationships with their spouses. And this lady is asking me, what are the real problems that prevent relationships from developing? There are countless ways that spoil relationships, but let's talk about 4 major ones that prevent relationships from cementing. Number 1 is trying to change the other person. We unconsciously think that if we change the other person and make him or her just like us, we will be very happy. We do not realize that the other person, like you, is not a perfect person. He or she has assets and liabilities in his or her personality, just as you have. And whereas you may try to smoothen out those sharp areas of the personality which are inflicting on the relationship, you cannot change the other person entirely. And it is here that you have to develop the art of acceptance. And acceptance means resigning to what the other person is and not getting upset about it. So stop trying to change the other person. If you start doing that, you could do it forever. The second important point that leads to failure is lack of compatibility. Compatibility basically means that your values and the values of the other person are more or less in alignment. Your goals and your views about important matters are in alignment. If these are extremely apart and if they are having no common ground, the chances are the relationship is going to suffer, because you are seeing the world from a different paradigm and the other person is doing the same from a different paradigm, and you will not be able to come together. And this is where, before getting married, you must examine your values and what are the values of the other person. And values means what are your views about, let's say, integrity, character, money, health, sincerity, adventure. These are things that you have to look for between yourselves. The more the values are in alignment, the better is the relationship going to be. The third factor that is going to affect is stop being jealous. When we get married particularly, or when you have a partner otherwise, we tend to become very possessive, and we confuse love with possessiveness. When we are thinking about the other person all the time, and when we are worried about where the other person is going and what he or she is doing, it's not exactly love. This is being jealous and this is being possessive. If you are constantly trying to capture the other person, you're going to make the situation very stifling and suffocating. And sometimes you have to step back to let your partner flourish. If you make a house and you bring two pillars together, they are of no use. They are only useful if you construct the two pillars apart. The same is in relationship. It's a tricky business. Too much apart will also not be productive. You will just go too far away. But if you become constantly enmeshed in each other, that too is not healthy. So you have to have it somewhere in between the two extremes that I've mentioned to you. Fourth factor is having very high expectations. In any relationship, it's somehow very difficult to decide what is the right level of expectations. The problem is, if you have too high expectations, if the bar is too high, then even the best person, a saint, will not be able to meet your requirements. And if the bar is too low and the expectations are too low, people will just walk over you. So again, here you have to decide what level of expectation is rational. My own advice is that in any relationship, you have to distinguish between what are your desires and what are your needs. Desires are those wishes or those expectations which, if fulfilled by the other partner, very good, nice, but if they are not, it's okay. And needs are those expectations without which the relationship will cease to continue. There is no compromise on them. For example, in a marriage, if your partner is unfaithful to you, if your partner is a wife batterer or a drug addict who will not recover, for example, then these are needs that are not being met. This relationship does not have future. So don't confuse needs with desires. Keep your expectations at a certain level where you are willing to give in on non-crucial issues, and you still have enough left in the relationship to find it joyful and fruitful. And my last question has come from a number of ladies who are about between 20 and 25 who are living in a joint family system, and they have their children who are going to school, and they have to cope with a number of people in the joint family setting, particularly the mother-in-law, some have sisters-in-law, and of course their husband. Now the problem comes when the mother-in-law or the father-in-law are too interfering in the way they should bring up their children or their grandchildren. Now here you get into a clash between generations. Obviously, the grandparents belong to a very different generation when values were different, when traditions were different. And the kids who are going to school now are belonging to a different world. The question is, as parents, do you have the right to decide what is best for your kids? Or do your parents or parents-in-law have to decide what is best for the kids? Now here, apparently it seems that the grandparents are very concerned and they are very much involved in the upbringing of the grandchildren. It may be so, but generally it's a different issue. The grandparents are living through their children, and now they're trying to live through their grandchildren. And this is because either they have nothing else to do, or because their own emotional needs that have not been met from different sources, they are now controlling the future and the educational part and general upbringing of the grandchildren. I personally feel this is not very healthy, because the mental filter of our grandparents may not always be that of a mature person. Our grandparents can have very low emotional level of competence, much less mature enough to guide their grandchildren. And here, the parents of the grandchildren have a difficult role to play, because on the one hand, they do not wish to annoy their grandparents with whom they are living and they're dependent. And on the other hand, they want their children to be brought up in the way that they want. There's no easy answer to this, except that the whole family should sit together and the whole family should discuss how the grandchildren should be brought up. And if there are any differences of opinion, it may be a good idea for the grandparents to give in on issues that are not terribly important and let the parents decide what is best for the children. In the whole process, the parents of the children need to be respectful. They should understand the concern of the grandparents. If the concern is rational and best for the grandchild, do it, act on it. And if you think it's irrational, tactfully deflect this idea of the grandparents. It's not easy, it's difficult, but that's the best we can do with the system that we have. Thank you for watching.